Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA County. With me today is our esteemed co-host, Ana Chavez Mancias, NALBA's Program Director. She'll be introducing herself here shortly. NALBA is a nonprofit agency dedicated to the well-being of Latino individuals, families, and communities across the United States. Our mission is to address the disparities and the barriers that affect Latinos, especially because it impacts their behavioral health and well-being. Today, we're excited to present our Plática series called Take Action LA County on reducing stigma and connecting community mental health resources to help individuals have access to help and recovery. Plática is the Spanish word for conversation. So today, we're going to have a conversation with our incredible guest speakers who we'll be introducing here in just a little bit. And they'll be talking about the services they provide to the individuals and families in Los Angeles County. And then we're going to learn about how we can connect the listening audience to those resources. NALBA would like to thank the County of Los Angeles Mental Health Department for all of their doing to make this series possible and to address the stigma issues impacting our communities across our nation, particularly in Los Angeles County. And in support of this campaign, NALBA is very proud to collaborate in this effort. Each week, we'll be conducting at least 2 of these Pláticas, and today you're going to get to listen into some incredible Latinas who will be talking about the services and offerings from their organization. So we're ready to get started. So I'm going to ask Ana to be the introducer. So she's going to introduce herself. She's going to introduce our co-presenters, and then we're going to get started. And we already have some questions lined up so that this way, both Alejandra and Ruth know that we'll start our conversation, and then we'll be asking you as the live Facebook audience to send in your comments, ask any questions that you have, and let's have a giant plática, as I would say, here in a virtual setting. So with that, Ana, over to you, and we'll get started.
Thank you, Fred. Hello again, everyone. My name is Ana Chavez Mancias, and I am the Program Director for the National Latino Behavioral Health Association here in Los Angeles area. I live here in the beautiful city of San Dimas. Prior to my work with the National Latino Behavioral Health Association, I worked for Pacific Clinics for over 19 years, providing bilingual and bicultural mental health and substance abuse services to children and families. Now, allow me to introduce our wonderful guest for today. I am super excited to have both of them here today. We have with us today Alejandra Aguilar Avelino. She immigrated to the United States from her native Michoacan, Mexico, when she was 8 years old. Alejandra has more than 18 years of experience in the field of community education. Alejandra's beginning were with Planned Parenthood Los Angeles as a promotora comunitaria. Currently, Alejandra is a program coordinator at the East Los Angeles Women's Center, where she provides sexual health and HIV prevention services and advocates on behalf of survivors of sexual and intimate partner violence. We also have with us today Ruth Rivera. She has gained valuable experience in developing, implementing, and supporting programs in the nonprofit sector. She has dedicated her career to working with underserved and disenfranchised communities. In 2018, Ruth joined the East Los Angeles Women's Center, first as a volunteer, then as a coordinator of wellness programs for the ELAWC's Crisis Intervention and Response Program at LAC USC Medical Center. Ruth facilitates training for medical providers, for social workers and administrators, and also provides counsel and support for medical professionals seeking information and education on best practices in working with survivors. So we're in for a treat today, Fred.
Yeah, I would say all I can say is let's get started. So I think what I'd like to do is ask both Alejandra and Ruth just to say a little bit more about yourselves, para que puedan conocer, ¿verdad? So people can get to know you a little bit. And thank you for that introduction of their professional bios. But Alejandra and Ruth, say a little bit more about yourselves.
Oh, go ahead, Alejandra. Gracias. Thank you so much. Thank you, Fred. Thank you, Ana, for inviting us to this very important plática. A little bit more about me. I have a commitment, a deep commitment to support survivors. And not only that, I also have a commitment to connect with other people and ensure that together, we work towards having a world free of violence. That's one of my commitments. And I'm very passionate about sexual health education, about breaking taboos regarding sexuality in our communities, because I know that is one of those issues that it's deeply connected also to mental health. So I strive to also be a very sex positive provider and engage others in having pláticas about those. Ruth?
Thank you, Alejandra, and good afternoon, everyone. Thank you for having us here. A little more about me. So like it was mentioned, I do work a lot with crisis intervention, and I think that that has become my passion more than anything, working within this field. I think when you come in working in the field of sexual assault and domestic violence, you kind of come in a broad base, and then you finally find your little niche, o el lugar donde tú te sientes verdaderamente que va a ser un impacto. And so to me, it has been working within the healthcare system and creating that correlation between domestic violence, sexual assault, and the healthcare system as well. So going out and educating doctors and nurses, knowing that a person who's going to come in at their most vulnerable is going to be able to get the proper resources given to them has been something that really makes me feel like I'm making a difference in my community, as well as my other part is I love working with policy. So anything that's going to create a sustainable change, that's going to be able to create some laws that are going to be, including our communities, making those voices be heard, things like that. That is what makes me feel empowered. And that's what keeps my passion and my fire burning and going and working within this field.
Well, I can tell you're on fire because, I can tell. And thank you both for giving a context, for the work that you do. And you, as you both said, you're very passionate about this. And that's exactly right. When you feel passionate about something, you put in the time, the effort, the energy to really help address the issues that you deal with. And you deal with some of the most complicated issues that can ever be shared and discussed. So we want to say thank you to you. And we have a couple of folks already on live Facebook commenting that they're listening into you. So you must have a fan base, I guess, because already we're getting some folks from California and other places commenting. So welcome to our Facebook audience for being here with us. So we're going to go over to Ana because, she and I tag team on this, right? So Ana, you get to ask the next great question. So go ahead.
Absolutely. Thank you, Fred. So we would like for you, for both of you to, again, take turns and tell our listening audience and those that are watching now and those that will be watching this later, can you tell them about the services provided by your organization and who you serve? Alejandra, would you like to go first?
Yes, of course. With the East Los Angeles Center, one of the things that we look for is to ensure that women, girls, and their families live in a place of safety, health, and personal well-being, first and foremost, free from violence. And so the services that we provide are all interconnected. We provide individual therapy for survivors of sexual assault and domestic violence. In addition to that, we provide case management services, crisis intervention for survivors of sexual assault and domestic violence. We provide HIV services for women living with HIV, especially those who have a history of trauma. We provide advocacy for survivors. We do hospital accompaniments for survivors of sexual assault, domestic violence. We also provide healing groups. We have a housing program, shelter for survivors. And in addition to that, we have healing circles for both, for men, for father figures. We also have leadership programs. One of those is our wonderful Promotora program that trains women in the community to on issues related to sexual assault, domestic violence, how to connect the community to our services. And in addition to that, we have programs that support families, like the nurturing program that provides support for families who have been impacted by domestic violence or trauma. And it brings about healing to the whole family. They learn about healthy parenting, about coping skills together. And Ruth, is there anything else you would like to elaborate on?
Yes, and we also incorporating piggyback off of what Alejandra has said. I think she covered a lot of our services, but two of the one that I do want to highlight because they are come out of the offices here is our rape prevention education program. That's our youth leadership program. That one is for ages 14 to 24. And that one is specifically done to give youth the power to put consent boundaries, how to have healthy relationships, things that sometimes are not spoken in the home. So we are trying to aim at an early start and how to give empowerment and give them a leadership role in their community, try to make their community a better place. So we do have a program that focuses specifically on that. That is our main prevention program, I want to say, and we say cutting the roots of violence, right? We want to get that done and that. So that is one of the programs that we have. We have a lot of trainings that happen throughout the year. It culminates with their youth summit every year that they have. It's open for the parents and the children and the youth, just so that they see what's going on. We also have underneath, like Alejandra was mentioning, our nurturing program, we have Project Heal. So in the last couple of years, we've always focused on the primary survivor or victim, and we'd like to heal them, set them off on their healing journey, really set them up with like well-being in itself. But we were noticing that this is not an isolated issue on one person. This affects the family unit as a whole. And so on top of the family nurturing program, we are now providing therapy for children 0 to 18 and their parents. It's the non-offending parents. So we do provide services. All of our services are provided for the non-offending person. So we do not provide like batterer programs or anything like that, but we do provide the person, the survivor, the direct programming for them. And if there is somebody who's interested in those other programs, they can call our hotline and we can refer them out to other organizations that do provide that program for them. But those, I think, are the two main that, besides what Alejandra had mentioned, that are our main services. And then also one more would be the advocacy piece, which is the counterpart to the promotoras. The advocates are the ones who are literally taking care of the hotline, going out to the hospital after hours, on the weekends, and this is all on a volunteer basis. So we really rely on them to be able to do that. And they have to take a lengthy 70-hour training that all of us that work within this field have to take under the Governor's California Office of Emergency Services project, that we have to all be certified in order for us to be able to be advocates in the state of California.
Thank you so much, Ruth. And in addition to that, we also provide support to people who might be sexually exploited. So through our human trafficking program, we have outreach services, and that means that we have the providers that go out in the community and talk about these issues, connect to women that might potentially be sexually exploited, connect them to services, let them know that we see them, that we hear them, and we are here for them. So what all of our services mean to the community, it just means this: if you are a person who in your childhood, in your adolescence, and now as an adult, you have had an experience of sexual assault, and you would like to talk to someone, even if it happened in another country, even if it happened years ago, we are here for you. By reaching out to our 1-800 number that's going to be listed for everyone to see. It's our rape and battering hotline number. We are here to listen, whether you just need to vent or request a service. We are here. Because many times people are dealing with ese susto, ese dolor en su corazón, en su cuerpo, in their spirit. They just want to be heard. We are here to hear you. If it also means that if a rape or an assault has just happened, we are here to accompany you to the hospital. We are one of many rape crisis centers that are in the United States, and we are here to help you. It also means that if you are in a relationship and you just don't feel good, you are feeling harm, you just feel it in your heart that this is not a healthy relationship, impacting your physical health, your mental health, your emotions, we are here to give you clarity, to give you support, and to hear you. And we don't ever judge. It also means that if you are a parent or a caretaker who witnessed domestic violence, or you yourself were impacted by sexual assault growing up, and now it's impacting the way you care for your children, or you would like to learn how to change those patterns, cut those change of intergenerational violence, we are here to provide you with tools, and we work with you hand on hand. That means that we are not just the experts. We listen to you, and together we develop a plan so that you can continue, para que sigas adelante, puedas hacer cambios. It also means that if you are a young person and you say, I want to make changes. I want to be more involved. You're a provider, or you are a community member and you're like, I want to join this cause, you can become a volunteer with the East Los Angeles Women's Center. It also means that if you are a woman living with HIV and you feel alone, you feel that no one understands you, or you need other women to support you, to connect with other women who are going through the same thing as you are, we are here for you. We have a place for you. And it also means that if you are fleeing from domestic violence or sexual assault, we can connect you to a safe.
And I do want to add one more thing, which I forgot. And we have so many services that sometimes as you're saying them, they start coming up. But we do have a special person, well, two people that work out of our office as well that deals directly with law enforcement. We know that sometimes, the systems that we all live in can be a little bit scary to navigate, especially if you don't know how to approach them. And so one of the things that we have is we have a person who focuses on going to court accompaniments. If a person has a restraining order or wants to place a restraining order with a perpetrator or somebody that's harming them and they want to have that, then they're going to go ahead and have a restraining order placed and they have to go to court. And so we actually have a person who works directly with the Family Justice Center, and they're able to not have to do that process by themselves. They don't have to go to that sheriff's window and submit the paperwork and did I fill it out okay? Was it done properly? There's a person that's literally guiding them and sitting with them throughout that process. And we also have our victims of crime advocate, because sexual assault and domestic violence fall under the victim of a crime as well. They're actually able to submit that as well, go to police accompaniments, all of that. That is something that us as an agency and our advocates are able to do. And just like Alejandra said, our executive director has a line, I think it's very beautiful, that when you heal a survivor, you heal a community. And it's very true. You're healing a whole community just by pinpointing that one person. So I think it's a very beautiful way of looking at it.
Wow, so many great services that your agency offers. My goodness, all that support. I mean, I hope that our listening audience and those watching today got that same feeling that I got, that it is a very supporting place. It sounds very safe. You're going to be made welcome. You're not going to be judged there. For to be able to access the services, the wonderful services that you provide. And you have everything from supporting the legal to therapy, counseling, and so on and so forth, medical attention, all those things for people that have experienced, unfortunately, or maybe experiencing some sort of violence in their life. So, wow, wonderful services. Very, very, very impressed. I did not realize that you guys offer all of those services, but like I had said earlier, I was so excited to learn about them more. So very, very complete services, very good services. So I hope that those listening and those watching today are taking a lot of notes, and they know that they can call Alejandra and Ruth and contact them if they are in need of those services. Thank you. Fred, back to you.
Well, yeah, I'm also impressed, and I want to share with you that one of the members on the listening audience, and we'll give a shout out to Tina, Sherry, and Dolores, but Tina said, she goes, amazing work. Serving those that care for survivors increases emotional support. And you already kind of created a welcoming space here, right? And that's a very powerful thing. You also created a safe place, right? To be able to talk about something that, in our country we struggle with, right? And that is, how do we talk about things that are emotionally difficult and painful, and physically and spiritually? And so I think, the way you're sharing this is already very telling of how you can help others. So because of all of that and the services you provide, I'd like each of you to give an example of how recently you've been able to help an individual or a family or a couple. And because it's a way of giving an example to people listening in, or who will listen in the recorded version, to what it looks like and what that experience must be like. Because what you offer is so important to our communities and to the people who you're helping. Give us an example. So each of you, think right now of some particular example that you can share, right? So we can ensure people's privacy, but more importantly is, how do we give an example for people who are saying, mira, eso es lo que pasó también a mí. And gosh, that could be me. I could maybe benefit from that. So I'm going to go in reverse order, right? We've been asking Alejandra to go first. I'm going to ask Ruth to go first. I don't know.
Okay.
We get into this AB thing, we'll start with the letter A, but no, we're going to start with Ruth and then we'll go over to Alejandra.
Okay, thank you so much, Fred. Yeah, I think that for me recently, it's mostly working, like I mentioned, is with the doctors. So to me, is getting those calls that are coming in that from partnerships that I have created. So getting calls from the medical providers, knowing the fact that sometimes even it has been employees within the medical campus who sometimes are seeing on my presentation, and they themselves are coming and saying, you know what, I saw this presentation you did, and I just wanted to say that's something I have gone through. That's something I have been through, or that's something I'm currently going through. And I didn't realize that that also is part of domestic violence, because we don't always just focus into such of the physical aspect of it, that when we start looking into the other ways of domestic violence, of that power and control that's exerted, then we start seeing that there's different modes of how these people are sometimes controlling somebody else. And so one of the things is that when you get a call from somebody who I did a presentation to, and it's somebody who's working within the medical campus, that, tech people would be like, oh, they work there, they have their life together, they're professionals. How is that happening to them? So when you see that it happens to anybody, that it literally, like, domestic violence can affect any person, any gender, it literally bypasses all of that. And when you have somebody come and talk to you and say, your presentation made a difference for me, now I'm seeking help and I'm going, I'm going to get something from your office, from your services that you're providing. So to me, that has been the most recent one that I did a presentation a couple of months ago, actually a month and a half ago. And it just so happened that somebody saw it and they knew that they needed to get the help right away. And so they were able to get the help that they needed.
Wow. Yeah. Perfect example, right? You inspire people to get outside of that space, right? Because sometimes people are absolutely thinking about this, they're dealing with it, but they're coping with it.
Exactly.
But when they feel that level of security, that sense that, this is a person I could talk to, we feel it, right? We sense that, ¿verdad? And so when you draw people into that space, which you're doing, it's such a powerful space, because you're now letting a person in their personal space, which they've guarded intimately, now connect with you. So I want to just say thank you for giving that as an example, because we hope that inspires somebody today to do the same as part of this program. So Alejandra, now we are going to go to the letter A. So we're going to go over to Alejandra. Give us an example.
Thank you. For me, I was very fortunate when I began working at the East Los Angeles Women's Center back in 2005. I had the opportunity to be trained in all the services that the agency provides. And so I have so many stories from stories of hope and support to survivors of sexual assault, domestic violence, youth, families. But the majority of the time I have actually worked in the HIV department doing prevention for many years, training promotoras on HIV. And also I had the honor to work with women living with HIV. One of those that so dear to my heart was a while ago. I was talking about HIV and how, you know, nowadays, if a person is living with HIV and they're on treatment, they're gonna be okay. And not only are they gonna be okay, but they can even become undetectable. That means that the virus is so well controlled, they won't transmit it to others. So I will never forget when I was providing support to women living with HIV. And there was a woman who was had been recently diagnosed, and she was just dealing with so many emotions. And when I was talking about sexual and reproductive rights, I was providing information about HIV and how you can live a healthy life while you are living with HIV and with treatment, and that you have the opportunity to have children if you want. And her face lit up. I can have babies. And I said, of course, you know, with a good plan from your doctor, you're able to do that. Well, I just saw her baby yesterday. She has 2 beautiful children who were born healthy. And not only that, she has gotten support in throughout, you know, a relationship that wasn't healthy. She was able to get support. And so she's doing so good. And not only that, she's doing good, she is also connected to other women and letting them know that it's okay. It's okay living with HIV. You can be healthy, you can be on treatment, you can be a mom. And not only that, you can be a wonderful mom as she is. And so that's one of the stories. And one that I don't want to leave without mentioning is the story. This one is an example of so many other. When a survivor face changes, when you tell them they are still just as sacred as they were before the assault. That is fascinating because their whole outlook changes, their mental health benefits. So that, you know, happens 24/7 here at the women's.
Wow. Well, all I could say is I'm a little breathless right now, Anna, but I can share with you that these stories that you're talking about, this is really what life looks like, ¿verdad? And we get to have a safe place to say it here. This is the venue, you're the vehicle and the voice to share those stories, because just as Dolores said, she said this, that sanctuary spaces in our society are vital for our care and well-being. You just precisely described that, right? Is that the person you served was in a safe place, a place where their well-being was of concern, and you gave them information that they may have never heard before. And look what it did, right? It leads to the sanctity of life, right? So all I could say is thank you for that example. I know Anna's already chomping with a bunch of questions here, so I better switch over to Ana real quick. Okay, we're just motivated by this plática, and thank you again for sharing these powerful stories. They have such meaning. So, Ana, ¿qué piensas?
Oh no, like when Alejandra was telling that story, that woman's face lighting up when she heard she could be a mom. I mean, I got goosebumps. I mean, wow, how powerful, right? Or even telling them that they are as sacred as they were, that they haven't lost that, you know, that they still have that value doesn't go away. So wow, so powerful to be able to help communities, women in particular in our communities in this way, right? So very powerful. Thank you to both of you for what you do for our communities. And I say for our communities because you're not just healing the person, right? When you're healing that person, you're healing the community. And I think we had made a comment to that before, right? By healing one person, you're helping heal their family. Therefore, you're healing our communities out here in Los Angeles. So thank you for that. Wow. you both left me speechless with your stories. But let's move on to our next question. And what we want to know is, how can you yourselves and even in your agencies, right, help involve our communities to reduce the negative impact of a stigma? Because as we know, these conversations that we're having them here in this safe space, like Fred was saying, right? But this is a safe space, right? But people don't always have those safe spaces. And a lot of these conversations may be taboo and carry a lot of stigma with them. So how can you as individuals help, and your agency help our communities, the people in Los Angeles, reduce the negative impact of stigma?
I think that the way that our agency, and part of the way that we have done it, is by providing a voice for people who have been marginalized, who have not been heard for so long. We are giving them a platform that maybe they didn't even know that they had. So they're able to now come and say that there are resources out there. We try to include everybody. So like it was mentioned, we are the East Los Angeles Women's Center, but we provide services for men. And unfortunately, sexual assault victims who are men are the ones that have the most stigma sometimes given. If you start putting our LGBT, Q as well, families and community members that are with that, they're also stigmatized as well when it comes to and them being a survivor. So for us providing, like, for example, like Alejandra was mentioning, the men's healing circle for men who have been survivors of some sort of sexual assault, and they're trying to heal, they're in a safe space that they're able to talk about what's happening and really come out from that. And then our fatherhood program as well. So trying to incorporate men into our work. I know disproportionately it does happen to women. We all unfortunately know that, but it does happen to men. And then also having men be educated. If we educate men and we educate our future generations of young men as well, then we're able to have a safer reality. We can reach that goal of having a world free of violence, and having a safe world for women and girls to live in, not having to be afraid at night, not having to fear walking down an alleyway, because it will be a healing place. So I think that that's one of the ways we go out to the community. Like it was mentioned, we have promotoras. We have about 450 promotoras. That's 7 collectives that we have. Our promotoras they give blood, sweat, and tears, literally for our agency. Están dedicadas, tienen una pasión, un corazón de oro. They are literally trying to reach out as many people. Some of them are survivors of domestic violence themselves or sexual assault in their home countries or here that they have gone. They strive through so much, and yet they're coming triumphant on the other side. And they're telling them, if I made it, you can do it too. Come join our fight. Join us together. We're stronger when we're together. And so it just has created this beautiful place that each one of them is so, although they're all promotoras, they each have their own collective, and their own collective does so much. They have book clubs, they have art therapy within each other as well. They have different things that they're going through just to heal their mental health as well of everything they have done. So I think that that's one of the ways I think our agency has been able to kind of end that stigma through focusing in those aspects of it in a very holistic approach. Alejandra?
Yes, and before we move on, Ruth, how many promotoras do we currently have, more or less?
I think it's about 450 promotoras at the moment. Yeah.
A great number. And in addition to that, we work in collaboration with partners, even non-traditional partners, right? To discuss these issues. As Ruth was mentioning earlier, we also advocate for policy change, right? And in communities, we engage in conversations. We are committed to change cultural norms, right? That normalize violence, right? Or stigma. One of the things that we do every year, we put together events. But one of the signature events that we put in every year is in the month of October. In the month of October, we have a vigil, and it's a vigil for domestic violence. It's a very unique, special vigil where we do a walk in East Los Angeles. We do a walk, and it has been growing year after year. It has been growing, both men, women, LGBT LGBTQ community joins, children, families join, and they give their testimonies of not only surviving, but also doing okay, changing, cutting those ties of intergenerational violence. And that I feel is very powerful, right? Because here we are, right, in the middle of East Los Angeles, talking about ending domestic violence and what it looks like to be free of violence. One of the things that we also do is every month in the month of April, we are very, unapologetic all year round. We are not afraid to bring up the issue of sexual assault and how it intersects with many things like substance use, chronic health conditions. And so in the month of April, every month of April, we dedicate, like Ruth said, our blood, sweat, and tears to highlight the issue of sexual assault.
And on that one, we did
Yes.
start a campaign. We did start a campaign 2 years ago. Like Alejandra was mentioning, like taking away that stigma, that cultural stigma that we have built, and we have created the Red Lips Hoops On campaign. And so it's called Red Lips Hoops On Invincible. And that is literally what we have created as, the color red, the hoops. We have heard so many derogatory terms that are going to why women couldn't wear red lipstick for a really long time, because that way it would look on them, or what they were going to be called if they were walking down the street. If you had hoops on, then there's so many sayings out there. So we're trying to take that rhetoric back. We're trying to take that bad way that it was being looked upon for women, and we have proudly wear our red lips, and we put on the biggest hoops that we can find, and we walk around, and that is exactly what we're trying to do. We're trying to change that so that people are literally have told us through our campaign that they were afraid of wearing red lipstick throughout their whole life, and it was because of our campaign that was the first time they ever actually felt that they could wear red lipstick, that they felt comfortable. And some of them are still struggling, and they're very honest. Even staff members that we work with are still in that process of trying to wear a red lipstick, and like they're not trying to feel that they're going to be looked upon, or those words are still in their head. So it shows you how something so small can make such a big difference. And like we have talked about, your mental health and creating such a different thing. When you put on, I know when I put on my hoops, which I have on right now, I put on my lipstick, I feel so powerful, and I know that I'm going to go make a difference when it comes to that. So that's something that we're trying to create, that atmosphere as well.
Wow. So it sounds like East Los Angeles Women's Center is doing a lot out there in the community to help reduce the stigma. So good job to East Los Angeles Women's Center. And you all, I'm going to have to join you next April. I'm going to go get the biggest hoops, so you guys send me the information, because look at Fred. He's like, Fred, you want to join us too? Yeah, absolutely. I mean, what a fun event. What a fun event to have, right? And even the events in the month of October. So we'll be on the lookout for that, now that the community and our audience is going to have your contact information. I encourage our audience to keep a lookout for those events and join East Los Angeles Women's Center on these efforts, again, to continuously reduce the stigma here in Los Angeles and our communities, and for that matter, in the whole country, right? Because it's not just something that is happening here in LA, or, just in East Los Angeles per se. But yeah, no, wonderful. Fred?
Gosh, all I could say is you were making me think back to those really kind of community mobilization. That's like the fancy word we use today, right? But how do we engage the community in our mission, verdad? So your mission is what drives your passion, because what you bring to the table is your blood, sweat, and tears. And then by reaching out to the community, to volunteers, to promotoras, your approach is very broad. Like you described it, it's holistic, not just for the services, but how the community is involved. Those are very effective strategies. And the more of it that we do, the better. And if your campaign is 2 years old or 20 years old, the fact that it keeps growing is a positive sign, because that means people relate to what you're saying. And because we become the advocates And as you said, you as an organization can take on that role, right, as a policy advocate, so we can help ensure that our programs can grow and that we can serve the community. And so like the Los Angeles County Board of Supervisors, for instance, they're like a perfect venue for hearing about this powerful work and how you can even approach them to support your efforts through proclamations, to acknowledge that this is a community issue, because they're the policymakers. You get to educate them just as they will educate us, right? Because they educate us in the process. We educate them on the experiences and the community experiences that you bring to the table. So I'm very inspired by hearing you taking it to that level too, because that's really a very good example of how the organization as a nonprofit is ensuring that it represents the community needs. So we did get a question on our chat, so I'm going to ask the question because part of it is you said that's something that really was very impressive, and when you said you had probably close to 450 promotoras, I just said, oh my God, that is a large cadre of individuals who are out in the community educating, informing, reaching out, talking to people about these issues. And that's a powerful energy that you have there. So the question is, well, how do you become a promotora, first of all? And then more importantly is, how can somebody be a promotora in your organization? Because in part, you already experience, you have training, you supervise people, you really help them be out in the community, because they become our eyes, our ears, and also get to voice the things that we want to promote, like the program you're doing, right? So anyway, maybe you say something more about that so that our listening audience can maybe say, well, I never thought I could do something like that. Or mira, they told me how I could do this. So why don't you spend a little time sharing with that, and then we'll come back to Ana in just a little bit.
Yeah, I can start off with the promotoras contra la violencia, and then Alejandra can talk about the promotoras working with the HIV. But the promotoras contra la violencia, that's our collectives as a whole. That's what they're called. There's a lot of promotoras out in the community. There is, otherwise known as community health workers as well. Our promotoras they come in and they take a training. All of the curriculum, it is a model, a national model that we have instilled. And it is literally all the curriculum Spanish. It is monolingual Spanish. So we have a lot of women who have gone through, like I mentioned before, domestic violence, sexual assault. And so a lot of them come in, and after they have healed their trauma and they have, then they want to give back. Sometimes they're like, I am now in a place where I want to get back to the community what I have received. So once that is the case, then they're able to call our office. And we have, like I mentioned, there's 7 collectives, and I hope that I get them all when I say them. But we have one in Compton, we have one in East LA, Boyle Heights, Long Beach as well. We have one in did I mention Compton? I don't know. South LA. And then our latest one is Lincoln Heights, and then we have a special one specifically for the KI, which is what we call them, the industrial workers. So we have seen that there was a high rate of industrial workers that work the night shift, that were being sexually harassed, that they don't know what their rights are as well. Their wages are being withheld. They're going through so much. And so we also have a special collective that works specifically with that group of people also. And so we have those 7 collectives are going. The latest one, like I mentioned, Lincoln Heights was the one that was established during the pandemic in 2020, was the last one. These women take a training, they go, and then they have to keep doing presentations and keep their promotora certificate going. They have been recognized by cities. So I know mostly from the Boyle Heights Collective, which is led by Jasmine Flores. And she is actually one of the ones who's being recognized by the city, by the mayor even, because of all the work that they have done in the community, because they have taken it out. On top of that, during the pandemic, they not only were doing work talking about domestic violence, sexual assault, but like Alejandra, it intersects so many ways. And COVID was a way that we also had a huge intersection of between COVID and domestic violence and sexual assault. So a lot of the times when the stay-at-home order was going on, a lot of perpetrators were living with the survivors or the victims at the same time. And there was exacerbating that domestic violence situation. And on top of that, we had COVID in itself to deal with. So our promotoras actually got trainings on going out into the community and talking about COVID in itself, telling them how to be safe, talking about going and talking to your doctors about the vaccine, trying to demystify all these things that were going all around. And so when they were doing that, they actually were able to reach about 500,000 people in LA County. That was the second from the Department of Public Health. So I have to acknowledge, and I have to say that because that's a really big thing. And once again, these women are not being paid. They are literally going out on the streets just because they want to heal their community in every which way. So they were at laundromats, they were at markets, they were at car washes, they were everywhere. And that's exactly the approach that they have taken with our mission as well. Going to churches, going to consulate offices. So this is the place, and that's how you become a promotora. It's just by calling and it's saying, if you're interested, taking that training. Once you take that training, if you keep going and you're interested in actually being more of like the hospital accompaniment piece or answering our hotline, then you do the second part of the training, which is the crisis hotline training. So there's 2 steps for it. But the first one is literally calling and just saying, I want to be a promotora to our hotline. And you get directed to one of our promotora leads from the 7 collectives, and they're able to reach out to you. And then there's an interview process.
Wow. Wow, ahí está. That's kind of like a step-by-step process, So, so for folks who are listening in, you just not only heard it live from Ruth, but we also have it in the chat, and more importantly, thank you for kind of outlining that. I know Alejandra wants to add a little bit more to that, and I do want to just say that when you use these grassroots approaches, what's powerful about it? It's about as close to the people that you can get, right? It's right in people's barrios or in their neighborhoods, the areas where they shop, and laundromats, men's barber shops, right? If you're wondering about where men talk to each other, it's going to be at the men's barber shop, ¿verdad? So el primito gets to talk to the youngster who's showing up to cut everything off his head because, hey, that's the style. But what happens is it creates the space for men to talk about these kinds of things. So training the barbers to talk about this and to posting the information there, it helps us to try to address the challenges for how do we reach out to men in effective ways. So in ways, the promotoras are just that. So Alejandra, I know you wanted to say a little bit more, so please go ahead.
Thank you, Fred. And we're truly a grassroots organization. And actually, I want to share a little bit of history. It was in 1976, actually, that a small group of Latinas in East Los Angeles, they were the ones that established the first in the nation bilingual hotline for Spanish-speaking survivors of sexual assault. It was just a small group of them that said, you know what, there is no one supporting the needs of Latino survivors of sexual assault. And so they got together, and that's how they established the first bilingual hotline in the nation.
And I want to add, sorry, Alejandra, I want to add, they had a bake sale to establish the phone line. Not only that, but they had literally a bake sale out in Atlantic Square to get enough money to get that phone line to be connected. So it's beautiful when you see it.
And you're right. And, we have been growing. I still remember when I joined, I don't think it was more than 9 of us. And now it's more than, I believe, 70 staff members. We have the leadership of Barbara Capos, who for many years, her background is in social work. She's an LCSW who has dedicated her life, to creating programs for families, for healing. So under her leadership, we have been able to grow. And I just want to put it out there, if any of you, anyone who would like to contribute to the East Los Angeles so that we can continue to support others, please do not hesitate to reach out to us, because it's actually thanks to the support that we get from donors, foundations, people that believe in us, that we're able to do this work. So I do want to say that, and when you mentioned the board of supervisors, we have support from supervisors. One of the supervisors that we're so grateful for, Hilda Solis. Mrs. Solis has been so supportive of the East Los Angeles Women's Center, and one of the ways that she supports year after year, one of the many ways, year after year, in the month of March, we are able to use the East Los Angeles Civic Center to put together a Women and Girls HIV Awareness Day, an International Women's Day event, where women learn about all the resources that are available in Los Angeles County for them. And in addition to that, they learn about self-defense, empowerment, self-defense, how to protect their body inside and out. And so we do that thanks to the generosity of Supervisor Solis.
Wow. I didn't realize. So you guys have events in March, April, October. Do you guys have any other big events, any other months of the year that you want to tell the audience about?
We do. Every year, we actually, in the month of December, we put together a tardeada for World AIDS Day. And in addition to those events, we have small events throughout the year, small events, culturally focused events where people can come in, get together, learn about services, connect to one another. And Ruth, is there anything you would like to add regarding all those other events that we put together?
I think, well, we also partake a lot in National Night Out, also in August. So we are literally out throughout the communities that we represent and we serve. All of us are deployed out. This is literally all hands on deck type of situation. And we go out for National Night Out too. So you can see us. And just like Alejandra was mentioning, though, we do more like small tabling. We go to community colleges, high schools. We go to literally here at the medical campus whenever there's something going on. We just are everywhere, trying to just create awareness into our community, educate. Our youth component is out in high schools constantly in February for the for Teen Dating Awareness Month, Teen Dating Violence Awareness Month. That is when they are literally going out. They wear orange. We wear orange as well in the organization to support them. And then in October, we have Health Cares About Domestic Violence here at the medical campus as well that we put together. So just to create, once again, that awareness and that correlation that exists between the two.
Wow, a lot of wonderful events that you guys have. So I invite our audience and those watching today to make sure they go into your website so that we can keep up with all these different events that you're having, and so that we're able to participate and support East Los Angeles Women's Center. So our time is coming towards an end. The hour went by so fast. We have only like 7 minutes left. So wow, this has been a wonderful conversation. So to end today, can you tell, and I know that we've been doing it throughout the Plática, but can we tell the people watching and listening today how they can reach you, how they can get a hold of you, how they can access these wonderful services? They might even be blessed enough that they get to meet one of you guys in person too. Maybe, you'll be the one connecting them or doing the intake, or, maybe even providing the services for them. So how can our audience today connect with you? Ruth.
Okay, sorry. Okay, so our hotline is I think the main one that I would like to say and stress. We have the hotline, which is for if you're going through just wanting to talk and get some resources. So that's one way. That number leads you to our shelter as well. If we cannot provide the shelter, we actually give out resources to other shelters within LA County, from Pomona all the way to Antelope Valley, that we have connections to be able to provide you some numbers. The hospital accompaniment also comes out of that hotline. And then, and like I mentioned, it's just the resources. And then we have our HIV hotline as well. And that is if you want more information, if you want to reach our HIV department, which Alejandra so graciously coordinates as well. So like if there's anything that comes out of that, you can call that number also. our Facebook page. We post a lot of events. Our promotora have also a Facebook page. They're also Promotoras contra la Violencia. You see all of their wonderful events that are going on as well and what they're doing out in the communities. Our Instagram, I think, is one of the also main ones, just to see what our agency is up to in itself. And that one we have actually 4. We have the main one, which is East Los Angeles Women's Center, ELAWC. We also have the ELAWC HIV. We have our youth one. That one, we like to talk about how empowered our youth are, and they're so on top of everything and putting all the cutting edge stuff on what healthy relationships are like. And then we also have our advocates one as well. So we do have different IG pages also, and just get a follow. And then that's the best way, I think, also to get connected to us. And then currently, like I mentioned before, one of the things was that fact that a lot of people couldn't verbalize what was going on in their homes during the pandemic. So also in 2020, we did instill the chat line now on our website. So if you cannot verbally say, and I do want to say this, if you cannot verbally say what is going on in your home and what is happening, because they're always constant listening to you, there is still help, and there's still a way that you can reach us, and that is through our chat line. It has a quick escape button. It doesn't show that you even visit it, but we do capture the information. There is a person that is there. One of our staff members is currently monitoring it from 9 a.m. to 5 p.m. Monday through Friday. And after hours, if you do send it, we do get that interaction, and we figure out a way how we can reach you and how we can connect you to our services as well. So that is one of the things, and it has been really successful, as well as equal to our hotline. Also, we have noticed that within the past 2 years that it has been established. Alejandra, do you have
yes, and I would like to say the number. It's listed on the chat, but I would like to say the number. The number to reach us 24/7, English and Spanish, is 800-585-6231. El número donde nos pueden llamar 24 horas al día, los 7 días a la semana, en inglés, en español, es el número 800-585-6231. Pueden ahí pedir hablar con alguien solo para desahogarte, y si necesitan conectarse con nosotros a la línea de VIH, 800-400-7432. You need to reach us on the HIV information line, 800-400-7432. And if you are a provider who would like to refer someone, or would you like to call and inquire about services for a client of yours, best number to call us is on the hotline, 800-585-6231.
Thank you, Alejandra.
Wow, I really hope that our listening audience and those watching are taking those numbers down. This is very important information to have. And I love the fact that you guys also have a chat line for those that, so you don't have, nobody has to feel like they are not able to, to say it or to verbalize what's going on. And it also sends the message that they don't need to live, within an environment of violence. So thank you so much for that information. Thank you for being here today. We are so excited to have learned more about the services of East Los Angeles Women's Center. Again, I am sure that our listening audience learned so much today, and now they have some great numbers to call and additional information for their consumers, even for their communities, or even for themselves. Fred, back to you.
Well, congratulations to you for an incredible job. I'm going to give you 5 stars. Okay, I'm going to give you 5 stars. And you really, it's on a scale of 1 to 4, so I'm going to give you 5. Phenomenal job. I think it's very clear that the services you rendered and the opportunities that you have extended to people in your community is phenomenal. All I could say is that I think as a community resource, you are part of the fabric of Los Angeles, right? You really represent the tapestry of how it is that we are at the core of the community to be of service to the community. So I want to congratulate you on that. What a phenomenal interview. Gracias, Ana Chavez Mancias. She's like the world's best co-host. All I could say is gracias. And she came prepared for this interview because she's wearing the color red, which is a symbolism of power, right? So red is defined as a person who's empowered, who's displaying their power and using their power in a positive way. So I'm glad you already now have the right colors for your next flag. Pretty soon you guys will have a flag that you'll have up in the flagpole, ¿verdad? Porque, you know, it's a way of symbolizing how it is that we protect the people we help and how do we re-empower people whose power has been taken from them. So I want to say thank you to the live Facebook audience who's been with us today. A quick shout out to Fernando Gonzalez, who dropped in a little chat inside there. We want to acknowledge him and any and all of you who are here today with us in this live recording. Again, this will be recorded and we're going to continue to play the recorded version. We ask all of you to share this with your family, share this with your community, your friends. Let's continue to get the word out because in part, you know, keeping silent sometimes can be hurtful. What we want to be able to do is empower people and be able to be of service. And so thank you for communicating and sharing because the power of our wisdom and our healing merits it. So with that, muchísimas gracias, Alejandra, Ruth, and Ana for this wonderful plática. I came by to this event really inspired because of what you've said. So with that, we thank all of you. Y ahí nos vemos, and we'll see you at the next plática. So please join us here at NALBA for next week's pláticas. Gracias.
Gracias.